To evaluate your gum tissue health, we have this really cool visual aid here. Have I ever shown this to you before?
No.
Here, go ahead and hold this with me. So what I want to show you here is we have 5 stages of disease. So in a healthy mouth, you can see here the bone level comes up nice and high on the tooth. The gum tissue is nice and pink. It fills in all those spaces, nice and pointy. And on the x-ray here, you can see the bone level comes up high on the tooth and fills in all the spaces in between the root structure. Now, have you heard of gingivitis?
Yeah.
Okay, so gingivitis is kind of its own unique category because the bone level is still nice and healthy. It's where we want it to be. And you can see here in the x-ray, the bone level looks good. The problem is, though, that the gum tissue has infection in it. When we probe around on these patients, you're going to see bleeding. Now, when we get into the early periodontitis category, periodontitis means that we have lost some bone. So even 1 millimeter means you have bone loss. So you can see here, just a little bit of bone loss here. So when we slide in with our little ruler, we're going to get a deeper measurement. So whereas these were 1s, 2s, and 3s, this could now be a 4 millimeter. And you see here the gum tissue is a little bit irritated, a little bit red. See that little red ring right there? And just a little bit of bone loss, about 1 millimeter. Moderate periodontitis, again, we're losing more bone. You can see here on the x-rays a little more bone loss. That probe's going to slip in a little bit deeper. And look at this gum tissue here. See how irritated that is?
Ew.
Advanced disease is going to be more than 6 millimeters. So see how deteriorated the bone level is? That probe just slides right in. You can see on the x-ray here, half of that root structure is not covered by bone. So we can have mobility there. And you see here the gum tissue looks really irritated. It's pulling away from the teeth. We've lost a lot of bone here.
That's gross.
Any questions?
No.
Okay, well, I'm going to sit you back. Listen for those numbers. Again, 1, 2, and 3 millimeters is going to be a healthy measurement. Anything above a 3 is going to be an area of concern. Anything with bleeding is going to be an area of concern. Okay?
2 minutes and 16 seconds.
Okay, well, Kristen, this is your chart. What do you think? Where do you think you fall in these categories here?
Well, it's not health. I'd say somewhere in here.
You're right.
I heard a 8.
An 8, you're right. So that does put you over 6 millimeters, which is advanced bone loss. Now, you do have a lot of really good bone over here, which is great, but I am concerned about an 8 millimeter pocket means you have lost a good amount of bone. So the problem there is that you have infection down in your bone. And I know it's infected because I can see bleeding when we probe there. Now, the consequence of just leaving it as it is and continuing to do normal cleanings is that we will see the disease progress, and you could potentially lose this tooth because of how much bone we've lost.
I'm going to lose my front tooth.
I know. Fortunately, I have a non-surgical solution for you. So what we're going to do, I'm going to have you come back in for another appointment. I'll be with you the whole time. I'm going to have you come back in so we can treat this one area right here, level 2. What we'll do, we'll go down under the gum line and clean out that infection down up against your root. We'll also place an antibiotic. It's called Arrestin. It's a little powder. It goes right down in just like the probe does, and it'll stay at the base of that pocket for about a month. And it releases its antibiotic properties so that the infection doesn't come right back. I'm also going to have you do a fluoride varnish that's going to help desensitize and also help kill bacteria. We're going to put you on a gel that promotes healing that you'll put on your teeth a couple times a day to help heal up the gum tissue. And then the most important thing that I'm going to get you started on is our Sonicare brush. We love this brush, and what you do at home every single day is more important than what I can do for you here in the office a few times a year. And this is going to help you keep those areas cleaned out. Do you have any questions for me?
No?
Okay. Now, I also wanted to let you know on your, on your medical, you did mention, you know, you've got a lot going on at work. Things are crazy. There's a lot of stress right here. I know you just have terrible dry mouth, and your lifestyle, no sleeping and partying all night long. This all
catches up with you, huh?
It really does. Kristen, it really does. And you know, I know your parents diabetes, cancer, we've got a lot of dementia going on. All of these things, you know, even if you don't suffer from them right now, if you know that your parents have, you have a family history of it, the mouth is connected to the body. It's not cut off right here. All that bacteria travels throughout the body, so they can affect each other in negative ways. Your risk or your prognosis, I would say, is fair because we already have lost a lot of bone. Surgery, right now, we're not going to talk about surgery. Extractions, we'll check in 3 months to see how this tooth is responding. The risk of not doing anything, like I said before, is that this will progress and we could eventually lose that tooth. I'm going to have you come back for about an hour and a half. We'll go ahead and get you numb so you're really comfortable. Clean that infection out and see how you do.
Okay. How much does it cost?
I am going to run this up front and the girls are going to check with your insurance. And before you leave today, we'll get that all sorted out.
Okay, thanks. Great.
So while they're checking on that, I'm going to go ahead and get started with your cleaning. So just so you know, today I'm going to be cleaning the top portion of your teeth, just like I always do at your normal 6-month cleaning. So when you leave today, that infection down at in that deep pocket is still going to be there.
Oh, okay. So can we schedule soon?
Of course.